All right, good afternoon, everybody. Here with Paul and Josh, and just as importantly, more importantly, Ingenuity and Albert Coe, who are co-leading our Reopen Connecticut initiative. And as we said a while ago, every Thursday they'll give us a briefing on where we stand and their recommendations as we focus on May 20th. They just got off an exhaustive phone conference with the legislative leadership as well as we try and work our way through a reasonable schedule that keeps us safe and gets our economy going again. I'll give you a brief overview on what their recommendations have been, and they're certainly here to answer any questions you may have. Just very quickly on the daily summary, first of all, I think negative 41 hospitalizations. I think that's the 8th consecutive day of hospitalizations going down. As you remember, our first benchmark was 14 days of declining hospitalizations. 89 more fatalities, increasingly in the nursing homes, I might say. That's something we have to think about seriously. The 933 positive cases, I think you heard from Rudy and Jane yesterday what a positive case is and how scary it can be. With that, I just wanted to walk you through some of the priorities and reopening criteria that the Reopening Advisory Board has come up with. And first of all, the 14-day hospitalization, declining hospitalization, we're on that metric right now. Number 2 is increased testing. We've talked about that broadly, but I want you to know this is not something for me to take lightly. This is not something for the business community to take lightly. It is absolutely vital as you look what's going on in Germany and other places with a slight resurgence if we're not absolutely careful. And also, testing is important for the businesses as they reopen. And we're finding that down in Georgia. Testing gives the consumer confidence that we're doing everything we can to keep them safe, even at that, say, open-air restaurant. So testing is on track. We're expanding that, and that's a real priority for me and a real priority for our team. Sufficient contact tracing. I think you heard over the last few days how we're ramping that up, hundreds of people making those calls. Again, give the consumer confidence that if they go into that particular store, we've got everything in place to make sure they're safe and keep the pandemic spread. Protecting high-risk populations. Let me say that in a personal way. I mean, it's the right thing to do. We know that certain members of our community are hit especially hard by this pandemic in terms of infections, in terms of fatalities. And we're going to focus on those communities, the African-American community, the urban communities, those who live in denser populations. It's the right thing to do, and it's also the smart thing to do. Because if you want to make sure that this pandemic stays under control, we want to do everything we can to make sure there are no flare-ups around the region and around the world. And that's why we look at each of these communities in the denser populations. We prioritize testing there, and we prioritize treatment to make sure there isn't a potential for a flare-up there. What that means for those families and what that means for the greater public health. We now have 2 mobile testing vans. One was in North Hartford. They're going to homeless shelters. They're going to federally qualified health centers, places where people can't get to a drive-through test. So we're taking those high-risk populations very seriously. Healthcare capacity, I think that's important for COVID as well as non-COVID related treatments. And make sure we have the capacity, which we do right now, to expand coverage and make sure we have room in case there is a flare-up going forward. Adequate supply of protective gear. We got a big shipment coming in the next day. We're getting gowns now. We have a good supply of masks, maybe less on the N95, certainly on the surgical masks. We're making those available to small businesses via the CBIA website. And we're monitoring this carefully. It's not like we have an endless amount of inventory, but as the Reopen Connecticut Committee tells us, expansion of the ability to provide those masks to more and more stores, more and more employees, more and more factory is key to our opening strategy. And finally, the appropriate physical distancing and the such. those regulations, sort of store by store and industry by industry. Indra's group, working with David Lamont, are working with the industry groups. It's not state government sitting there saying, these are the protocols that we think are best for you. We've got the Restaurant Association, the Retail Association, the Hospitality, all coming to us with really thoughtful ideas on how they can keep their employees safe as well as their customers safe. And there's nothing more important to a small business to make sure their customers feel and know that they're safe going into that particular facility. This next chart, I think, is interesting to me on a couple of different fronts. This shows you what percent of our economy is already open and as a percent of GDP and how it's reflected in unemployment. Let me give you some broad numbers. We have a GDP, the value of everything bought and sold in the state of Connecticut, is about $245 billion. And if you want to see how our economy is put together, you'll see that about $106 billion, as you can see on that chart, is reflected in things that have always been open. That's essential retail, construction, manufacturing. That is a big piece of our economy that never closed and stays open. And yet about 11% of our total unemployment is reflected in those particular businesses, and we watch that carefully. That could be the fact that in construction, new home construction's not picking up, it's slowing down. That could be the fact that Pratt & Whitney, open, staying open. Stanley Black & Decker, open, staying open. But because of loss of demand, there are some layoffs there. But that's, let's say, 30% of our economy open. The next piece over there is open but closed due to a lack or fear of demand. That's 38 out of, that's what, 10% or something of our overall GDP there. And what does that mean? That means we never closed down childcare. Thankfully, we didn't, because we needed those daycare facilities open for at least for the first responders. But a lot of them did close down due to lack of demand. Landscaping, hardware, a lot of facilities that are open right now, and we want them to be open right now. But you'll see that a lot of them aren't open. That represents a smaller piece of our economy, about $37 billion. And more importantly, it's about 29% of our overall unemployment rate. So 40% of our overall unemployment so far, as you can see, is related to things that are open. These are things that I'd like to think we have a good chance to get back going sooner rather than later. In particular, that group that's in landscaping, hardware, childcare, open, but due to lack of demand, not going as fast as they could. The third category you see there, which is about $77 billion out of $245, is open, but they're working remotely. This is technology, insurance, finance, professional services, those that you can continue to do through telecommuting. And maybe over time, we're giving people a green light to go back to office if you have to. And my advice is probably don't have your entire staff there on any given day. Maybe you divide it up half and half in case there was infection. And of that, professional services, media, finance, insurance, capital of America, that represents only about 12% of our overall unemployed. And those economies are going to continue to go. But you want to know where the other half of our unemployed come from? They come from a group that represents just 10% of our economy. That's the service economy. Those are restaurants, salons, bars, and the such. Those are very people-intensive. So while they're not a big piece of our overall economy, they're an enormous piece of our unemployment rate. And that's the group that we're going to talk about in particular today, as we slowly phase them back into the workforce starting on May 20th. So very quickly here, the how and the what, which our committee came up with, how we will operate, what are our reopen levels. Again, how we operate, we got a lot of that best intelligence by working with the business community and by working with the labor community to make sure that everybody who goes back to work is safe. And business and labor are both represented on these committees. And then what will we open? What will we open? Phasing by type of business. And that's interesting in this sense. You know, some places are talking about let's open this region but not that region. Some places are saying people under the age of 30 go first, but not people over the age of 70. And, you know, Indra can explain, we have some of those demographic and regional considerations, but primarily the recommendation, which I'm very sympathetic to, is open up by industry types that you can do safely. What do I mean by safely? This is how our committee ranks in terms of what we can do safely. One is what they call contact proximity. And that's, I think, a fancy way of saying how close you are next to each other in your particular place of employment and how much social distancing you're able to do. The next category is called contact length. In some places, you're maybe next to only one or two people, but you can be next to them for, 10 minutes. So there's a greater opportunity for that virus to spread. You can imagine the difference between, the factory floor and the nail salon as you think about this. Number of contacts is in that same category. How many different people are you seeing over the course of that period of time or over the course of that day? So that is one broad category as we think about what businesses we can open when. And I was talking to Albert and Indra a little bit ago. I would put under that or within that category indoor, outdoor, because indoor the germ is much more likely to infect than it is outdoor. The second health risk scoring that we've identified is one, what they call disinfection. And that's how, by working with local businesses and labor, we can regulate the safety within a particular facility. How often should you be disinfecting? What are the rules in terms of other protocols there? What are the social distancing rules? How safely can you do it if it's a small store versus a big salon? So that's the health risk story that our committee came up with, an amazing group of individuals from science as well as business. This next chart is just a little broader in terms of most restrictive to least restrictive as we open up starting on May 20th as we go through the summer. And I'll just tell you that broadly speaking, it's maybe there are different categories in there in terms of how big a group. We go with a 5 to 10 now. We can have bigger groups later. Maybe we say everybody over 60 should stay close to a home now. Maybe later on in the season it's over 70. What are those protocols in terms of social distancing? You'll see that ramps down as we reopen level 1, and that gives you some broad sense of how we think about the reopening strategy over a period of time. And next up is probably the one most relevant. And this gives you our preliminary ideas based upon the facts of the ground, what we think we can do when. Right now, as we said before, well over 60% of our economy is already open: manufacturing, essential retail, real estate, utilities, construction, childcare, daycare, and hospitals, although some, as you heard, are not operating at full capacity right now, which is why it's so important that we give people the confidence that they can go back when it is safe for them to go back. And what we're thinking about right now in terms of opening dates is as follows. Restaurants are a big piece of that service economy. I know what that means in terms of employment. I know what that means in terms of bringing our cities back to life. And I also know what it means in terms of a virus spread. And there we're talking about allowing restaurants to open outdoor only starting May 20th. And, as Albert would tell you, that's conditioned upon making sure we have the testing, making sure we have the contact tracing. And I'll be particularly interested in looking at what's going on in Georgia and Oklahoma and some of those states that have sort of a 2-week, 3-week head start on us in terms of 4-week head start on us in terms of opening up a facility like that to make sure we don't see any surges or spikes in there. The remaining retail we're looking at, those are the smaller stores, right on Main Street, the toy store, the shoe store, boutique, jewelry. find out what are the rules that we have there in terms of social distancing, mask going forward. Offices, we talked about that, where we still recommend anybody that can telecommute to do so. But if there's some need for some people to go back, this is a time that you can start putting your foot in the water there. Let me skip over personal services for a second. Museums and zoos, let's start on May 20th. Let's start with just outdoor only. I'm hearing from Mystic Seaport and others, this is how we want to open, and this is how we can do it carefully. And getting good intelligence from them gives us some confidence that we can slowly open the spigot and allow people to visit there. Additional outdoor recreation, camping, mountain biking. I was interested in reading the Hearst poll I saw in the newspaper the other day, and said the #1 thing that people in Connecticut want to have reopened again are parks and hiking trails. Well, we never closed our state parks and hiking trails, but this is just broadens that in terms of camping and other recreation, university research programs. Personal services. I say that with a little note of caution on a personal basis, but I'm going to follow the lead of people who know better. I know how important hair, barbers, salons, nails are. I know it's been a long time. I know it's getting a little awkward. I also know that it's tougher to enforce social distancing in an environment like that. But based upon what we see in Georgia and other places, people aren't flooding in. People are doing it by appointment. So Indra and Albert and their team, we're going to come up with some protocols that maybe give us the opportunity to get that started up on a limited basis starting on May 20th. So May 20th is an important startup date for us. I know you're wondering about some other activities, and we're going to report early next week on schools and other social gatherings. So if you would, give us a little more time as we try and test that out and get a little more information than we have right now. And you know, with that, I guess maybe we should just open it up to questions, unless Albert, Indra, is something you'd like to add beforehand. How about some questions?
Channel 3 Eyewitness News.
Yes, Governor. I mean, I think this is the information that we've been looking for ever since the state went into self-quarantine. Are there going to be any age restrictions on who's going to be able to go back? And if someone of any age is a little, I guess, a little hesitant to go back to work, is there any protection for them?
I'll start, and then let me ask Indra or Albert. I think you're going to find a lot of self-policing. People over the age of 70, I will argue it's still unsafe for them to go out, even on May 20th, to some place where there's a group. Right now, the folks who are older are self-policing, and I think that's really important. Whether we have to set regulations around that, let me ask the experts.
Yeah, so thank you for that question. Now, even as we go to reopening in very baby steps or small steps of the economy, we're going to be worried about the people most vulnerable for the, from the COVID virus. And those are going to be, of course, the elderly. So certainly the recommendations are going to be continue shelter in place for the elderly. These are going to be certainly the people who have the highest risk, which are over 70 years of age. And then we're going to be going by industry to industry to develop methods of protection. Of course, there are people who are working over 60 years of age. That's the work we're doing right now to exactly understand what the risk is and how that could be potentially mitigated in different environments, and whether sheltering in place for that age group is going to need to continue.
And then will there be any protections for someone who, doesn't fall into an older age range category, who just isn't comfortable?
So as the governor said, these are opt-in, requirements to going back to work or actually going out in public. I think the bottom line is that we want to protect the elderly, given their risk. That is going to be, an important way that we're going to mitigate or reduce the overall harm in the population. In terms of, just to reinforce from the public health side, the other groups that are at risk, these are people who have comorbidities or have underlying medical conditions. They are also an important group that we're going to want to shelter in place and come up with specific recommendations to protect this group.
Fox 61.
Industries listed under May 20th. Does that mean all locations will open on that exact date, or will they open group by group, day by day?
Well, certainly it's up to the locals. We're just saying you have a green light to open if you want to. And as Dr. Coe said, nobody's obviously required to go, and I think a lot of people are going to self-select. I'm finding in Georgia and Oklahoma, people are not going back quickly, and all stores are not opening quickly. A lot of them, certainly in the more urban areas, are slower to open just because they don't quite feel confident yet. That's why I really rely upon the scientific team to give us confidence when people know they can get back and do it safely.
And then on the Department of Labor call this morning, the Deputy Commissioner said there's no staff, ability, funding, or time to establish a call center for those needing to reach a real person for help. And Governor, we at Fox 61 sent you dozens of questions from people who have waited months with no answers from the Department of Labor. Will you consider allocating funds to the department to establish a call center?
These are, you want to take that, Paul, or I got it?
Go ahead, Josh. Yeah,
The Department of Labor is basically, almost through their backlog. The $600 checks are going to be all caught up. The top up for the $600 is going to be caught up retroactively by the end of this week and going forward. And then, as of today, the department's accepting applications for the last piece of this, which is for self-employed freelancers, gig economy employers, the pandemic unemployment insurance. So they've made tremendous progress. And I think as they dig out from underneath that, people who have questions will get those questions answered. We've given them every resource they've asked for through this, and if we need to allocate more, we will.
Lastly, what action has been taken against restaurants open illegally during this time, and has that even been an issue?
I don't think it's been an issue. I think I've been really impressed. People have really followed this using their own discretion, using their own good judgment. I think that the community has been sort of strong in terms of enforcement. We don't really want you to open right now. I think consumers will vote with their feet if they think stores are opening up too soon. And if there have been 2 or 3 outliers, we've heard about it, and the authorities have gone and told them this is not appropriate.
Move along next to the Connecticut Mirror.
Yes. So it looks like a part of this plan is trying to balance the economic impact, the employment impact against public health concerns. So if all goes well on May 20th, what percentage of the folks now unemployed will you expect to be back at work?
You want that, Indra? Unmute.
Unmute.
She's given a really eloquent answer with the mute button on.
It's too early to talk about how many people will go back because it's the consumer demand. And if Georgia is any example, consumers are staying away. So we have to figure out how to do marketing programs to bring consumers back into these establishments. So I think about 3 or 4 weeks after reopening, we should have some idea as to what percentage of people are actually going back to work and not claiming unemployment benefits. Too early.
Okay.
As we do know that from the industries that are on the May 20th list, they represent 30% of the total unemployment claims. But as given the restrictions around them, so for example, restaurants, if it's only outdoors, we know they're not going to go back to a full staffing level immediately. So as Indra mentioned, we're going to have to see how that plays out depending on the conditions that are imposed on those facilities, the social distancing, meaning less people in. So we're going to have to work our way through it.
Well, as much as I hate people who ask the when will we get there question, I'm going to ask, what is your best assessment on what this might look like, say, by the middle of summer? Do you guys have, based on what you've seen in New Zealand, because I see New Zealand has a similar 4-level risk factor that they've been playing with for a while, and some of the states have done similar things. Do you have a handle on what Connecticut might look like by midsummer when it comes to employment and social activity?
My instinct, Paz, is that the consumer is going to get back slowly. I thought maybe there was pent-up demand and everybody in Georgia would be rushing into the restaurants and nail salons, and that does not seem to be the case. I think that the consumers and the people of Connecticut, you might find, are cautious. So as Indra said, that's why we really want to rely upon the scientific community so we can give people confidence when it's safe for you to go back at each of these different stages.
And is the advisory group going, this is, I guess, more of a slideshow. Is the advisory group going to be putting out a fuller report that we can see that will address some of the concerns that have been raised about public access to records and conversations? So how are we going to see what's been going on behind the curtain to come up with this outline?
Well, I think you're seeing some of it right now. The two leaders of this are here answering every question. They just answered questions from the legislative leadership for some duration, and we'll do this more frequently as is needed. But I just really got to thank you guys. You put together, close to 50 people, the best and the brightest, academic and business, and what you got done here in 2 weeks to me is remarkable. I'll try and do the best I can, Paz, to explain each and every decision. Their advisory, we make the decisions going forward, and let you know what we decided and why we decided it.
And last question, I see in these risk levels, there's going to be specific guidance about things like wearing masks, of what age group should be staying home, things on telecommuting. Can you give Connecticut people sort of an idea of what to expect about what social distancing, what role social distancing will continue to play in their lives, and for how long?
So let me, go ahead, Albert. Unmute.
He only went to Yale,
All right. Thank you. So as we had discussed during our previous press conferences, this is a virus which is very transmissible. This is a virus that's not going to go away. It's not going to go away even with our best, public health prevention and control measures. This is a virus that it's going to be, we're always going to have the threat of resurgence. And it's also a virus that we're going to have to come up with better tools and better actions. These are, better means of prevention and control. And those are going to be therapeutics or medications, and the other is going to be vaccines. And those are going to take a time. They're going to take 1 or 1.5 years from now. So then the question is that what do we have to do in order to, the social distancing and the strong social distancing that we have, we're going to have to keep those going. And that's integral in that the phase-in program that the governor has just explained, is that we're going to have to continue strong social distancing based on principles of maintaining physical distance, also decreasing the duration that people are in contact with each other and the number of contacts that people have. And this is going to continue through the summer, and it's going to continue until we have a better mechanisms or interventions to stop this virus.
I think, Albert, it's safe to say that as part of the protocols we will provide to go from reopen level 4 to 3 to 2 to 1, there are very clear directions on social distancing, how many people can get together in a group, how far apart should tables be in a restaurant. The protocols give you incredible detail. And so all the questions you have regarding hygiene levels will show up in those reopen level details.
Thank you.
Move along next to the Hartford Current.
Thanks, Max. Governor, obviously we understand that this has to be phased in and it's industry by industry, but how do you envision some of the broader industries coming back? And by that I mean whether it's July or August. When do you see the casinos coming back? When do you see the Hartford Yard Goats coming back? Some of the larger venues that have not been mentioned here.
I think they'll be a little longer coming back. I'll defer again to the advisory board on that, but those places where it's tough to socially distance, those places where you have a big crowd, I think are a little tougher to make sure that we keep this virus under control. You know, that said, I was sort of sympathetic to the Travelers Golf Tournament because that's not being done in front of a crowd. I understand the need to get you know, some pride and some energy and some sports enthusiasm back in what we're trying to do, but only if we can do it carefully. So I think we're going to be cautious on that front.
And we've talked to the casino people, and they have a sensible plan that they're developing to socially distance and not have too many people together when they play bingo or any game like that. But as the governor said, we're going to learn so much with phase one. And as our learning improves, we can decide what else to include as we go along. But it's too early to ask about all of these high contact venues, but more importantly, people who come from out of state. Remember, to these casinos, people come from Massachusetts and New York. So this could be a prime outbreak spot if we don't manage it very, very carefully.
I might add, Chris, if you're looking at that picture of Indra there, nobody wants the baseball and New York Yankees to come back more than Indra. You may think she's more of a cricket girl, loves the Yankees.
Yes, no, I only ask as we're heading towards the summer. Also, Governor, on the broader economic impact of all you're talking about here today, the consensus revenue estimates are out today, and the tax collections are obviously down, but do you have fears that the tax collections could be worse and will be worse, frankly, going forward because we don't know exactly when all of this stuff is going to reopen?
We have a pretty good idea of how things reopen. We don't have as good an idea about how fast the consumer comes back. And that's a real risk, no question about it. You know, in terms of income tax, you maybe see that piece of the GDP that could come back more strongly, but we got hit hard on the sales tax, and you know, bars and restaurants and those type of facilities may take a while to come back, and that is going to hit us pretty good. It's going to hit all of our neighboring states pretty good as well. And Melissa and I will be here to talk about the entire budget and the consensus forecast tomorrow.
Okay, thank you.
Connecticut Public Media.
Thank you. I have a question for the committee. Wondering if they can talk maybe a bit more specifically about protections you are thinking about for people with pre-existing conditions like diabetes or asthma. You touched on it a little bit earlier, but I guess I'm just trying to get a little bit more clarity on if an individual does have a pre-existing condition, but wants the economic opportunity to make a living. How can they do that? I mean, are they going to be expected to isolate until a vaccine is developed?
Right. So I think that this is going to be also in the phasing of the, as we're reopening the economy. So one thing that we really need to be careful about is what the transmission rate is. So we know that transmission is, probably going to be the driver of risk. How many, contacts people come into, how many people are being infected. One of the things that we're going to do is for those groups that have to work, we're going to we're actually in the process of coming up with guidelines about when would they be able to safely come back, given calibrating that, given the underlying risk of infection or transmission in the community. And so going on to the first part of your question is what can they do to prevent? And it's the same recommendations that we're giving to the general population. First of all is the use of face masks. So face masks are important, not necessarily for people to protect themselves from getting infection, but it's important from people who may be infected. And as we mentioned before, there are a large number of people, or the majority of people infected with the virus actually don't show any symptoms. So by people in society, our fellow citizens using face masks, that's a very effective way of if they're infected, of preventing infection to other people, and particularly those people who are vulnerable. Those people have underlying underlying medical conditions. There are other practices that are going to be also important, and I think the health education part of this campaign to reopen Connecticut is going to be essential, whether it's disinfection, hand hygiene, maintaining social distancing. Those are all the mechanisms that are not only going to keep our population safe, but keep those people with underlying medical conditions, those people vulnerable for the severe complications of COVID protected.
And so will there be regulations put in place to ensure that employers do these things that you're outlining, Dr. Koh, provide face masks, ensure that facilities are adequately disinfected, things like that?
Right, I'll work off of Inda's response. So this is all work in progress. We have teams, of the best experts here in occupational health, but also voices in labor and business working together in synergy to come in to really identify what are going to be the best practices. We also have done a literature review, or we've gotten materials throughout of all this United States and other countries of what those best practices are being done. But we want our experts on the team to even get better practices and ones that are tailored to the industry here in Connecticut. Those are the ones that we're working towards from the next week and the week afterwards in preparation for reopening Connecticut.
I think the good news is that a lot of the businesses have done a lot of this work already. Many office, commercial property owners have developed a plan to restack the office with social distancing. We talked to the mall operators, the mall owners, and one of the biggest mall owners said that they've taken all their malls around the country and created a grid with social distancing to decide how many people they can allow and how they should manage the traffic through the mall. So I think you'd be surprised how much work people have already done taking into account these hygiene factors. So we can learn from them and then make sure it's adapted for Connecticut from that base of knowledge.
Thanks.
The Day of New London.
Hi, good afternoon. It's Karen Florin from The Day. The president and CEO of our community hospital here in southeastern Connecticut said yesterday that the virus hasn't peaked in our area and we might even have a surge in June. Does the entire state need to be on the downside of the curve before any of the state reopens, and might there be a region by region reopening?
I'll start with that, and then perhaps you'd like to say something. But what we're referring to is the fact that in eastern Connecticut, New London County, closer to Boston, where the pandemic is still hot, we've had some pickup in terms of hospitalizations. I look at the broad number across the state to see what our capacity is and see what the downward trend is, but let's hear what the experts say.
Indra, would you like?
No, go ahead. He said the expert.
Good. Indra, you gave a very nice answer to the legislature. So I'm just going to repeat that answer. So I think one of the major issues is that we live in a highly interconnected city, state, and region, and that when there's an outbreak in one part, it does affect other parts of the state. So in order to, so one of the principles of it as an infectious disease epidemiologist is that you really want to make sure that the source of these infections are being controlled. And in doing so, to actually protect the greater population in our state. Those sources of infection may be within our communities. So that's where, to reopen the state, we have to see all counties and all cities within that, where they are in the curve. We can't leave anyone behind in that sense. The other is that we have to be very vigilant about what's happening in our neighbors. There's a recent outbreak in Springfield that will potentially influence the counties that are proximal to that in the state of Connecticut. So I think the bottom line answer is that we live in an interconnected state. We have to make sure that all of Connecticut is safe in order to ensure that all parts of Connecticut are safe and to ensure that the general population is safe.
Thank you. And next question. We had an announcement here of a beach closure in Old Lyme, Connecticut. And I wonder if there's and it's supposed to be temporary based on sort of the, what's happening with the cases. Is there any attempt to coordinate beach and park closures and then reopenings so that you don't get the effect of people coming, from one area to the other when their own nearby facilities closed?
Well, I'll start with that. Yeah, I talked to my fellow governors on that a lot. We kept our beaches and our parks open. My understanding is Rhode Island is soon to open their parks and beaches, and New York is considering the same for parts of their region. We're still clarifying that. What you're maybe referring to this last weekend is during one warm day, Saturday I think it was, we did have to close off parking at a certain point because it looked like they were getting overcrowded, and I think we're going to have to be pretty strict on that. You maybe see that Gavin Newsom, the governor of California, it was a beach day last weekend. A lot of people were out there, and now he's threatening to close down all the beaches, which is a big, big deal in California. But we're watching that closely, and we are coordinating with our neighboring states.
Thank you, Governor. And one last question. The grocery stores seem to be like the central gathering place right now, where you are most likely to have a lot of public contact. Has the state been tracking in any way illnesses within that industry, the grocery industry?
You guys know that? Let us get back to you on that. That's a pretty good question, though.
Thank you.
Move along next to Boceto Media.
Hi, good afternoon, everyone. Governor Lamont, is the state of Connecticut planning to establish a package? I'm sorry. Is the state of Connecticut planning to establish a package for rent mortgage relief to prevent homelessness in Connecticut, and that way save the economy, as we don't know what percentage of people will be employed once you open the state? And I also have another question.
I missed some of that. Did anybody get that?
Your audio is breaking out. We'll try our best to come back around. Hearst, Connecticut Media.
Thanks, Max. Hey, Governor, so I'm assuming that concerts would be included in that. Take a look in the future and see how it looks after the May 20th opening. Have you come to a conclusion about whether we're going to be voting by absentee in the fall and for the November, or is it still too early?
I'm not sure what authority I have going all the way to November, but I certainly think our primary in August, we ought to allow some form of absentee balloting, especially for seniors who may be still under a stay home, stay safe order.
Thanks. And Dr. Coe?
Yes.
Could I ask you, they're talking about opening up outdoor sections of restaurants, but you would still have to go inside to a bathroom. And knowing COVID's aerosol lingering abilities, I mean, how safe would it be to go into a tiny space like that? Even, the outdoor restaurant's one thing, but an enclosed bathroom is something else.
Yeah, thank you for that question. That's actually raises an important public health point. So you can get the virus, spread person to person through droplets as we speak, or cough or sneeze. But the other way is if those droplets actually land on a surface. And the good news on that is that, and that's why outdoors is good, is because when we get into the warmer months, we know that the virus survives less well when it's warmer. And we also know that sunlight can inactivate or kill the virus. When you're inside, we're going to have to use disinfection. And so inside these regulations, and particularly in places like restaurants where people actually have to come in, not only the people from outside who are dining outside, but also the workers and the cooks and so forth. There's going to have to be frequent disinfections of that place, and use of hand sanitizers as people are touching surfaces that may be frequently touched by other places. So those are all going to be rolled into the recommendations and the guidelines and best practices that the committee is developing at this moment.
And there's a lot of
Thanks.
training that has to happen, a lot of training.
Thanks. And speaking of best practices, is there a statewide protocol now on hydroxychloroquine, or is it still up to the individual physicians?
Yes, so the hydroxychloroquine, actually there's, this is still in clinical trials. It's under evaluation. And I think in the past, we've discussed this issue at previous press conferences, but at this point, there's really no evidence to show that it's an effective treatment. These are things that are going to require continued study under what we call clinical trials, which will provide the most rigorous evidence of whether it's something should be used. I think there is one concern about hydroxychloroquine, and that was in a recent article, is that there may be side effects that may happen, and also side effects when it's given with other drugs. And that's something that is a concern for us. And I think this is something that certainly there's ongoing investigation into understanding what those adverse effects are. But at this moment, there are no recommendations for its use, outside of the clinical trial, setting.
Thanks. Hey, Josh, can you confirm a report that there's been an active duty police officer who's died from COVID?
I have not heard that.
Okay, thanks a lot. Thanks, Max.
Waterbury Republican American.
Good afternoon. This is a question, I guess, for Josh and the governor. I had a chance to speak to one of our readers. He's an older gentleman. He doesn't have a smartphone. He doesn't have a computer or a tablet. Can't afford those on his fixed income. He had a devil of a time trying to get unemployment benefits. But he's also saying that he's also having difficulty, or at least people in his position are having difficulty accessing information and resources that are being made available online. So what are you doing for folks in that situation, and what sort of reassurances can you provide them that they're not being overlooked?
One of the key things that we've done to address that concern and make sure all the information related to the state response and resources for this crisis is to partner closely with 211. So all of the FAQs, all of the information is updated regularly with our 211 partners run by the United Way. So anyone who can get to the phone at least can call 211, get their questions answered, or get referred to resources or services that they need.
Governor?
Yeah.
Your thoughts?
I think my thoughts are the same as Josh's thoughts. The telephone is a good way to go. I got to give a little shout out to United Way and 211. The number of calls they're taking, 2,000, 3,000, 4,000 a day. A little less COVID related, we found out today, a little more about, as you say, unemployment claims and things as regards their day-to-day lives, more attuned to what 211's been in the past, and they can reroute those calls where they're appropriate. A lot of those calls are going to amazing not-for-profits for people in distress, people in anguish, people in mental need. And that's part of what 211 does as well. It's really an amazing resource, and I got to thank United Way every day.
In terms of when you relax your orders, you mentioned earlier that local governments might be able to impose restrictions. So I'm just wondering, will your modified orders provide latitude for local officials to determine whether or not non-essential retail businesses, restaurants, and bars will be able to reopen in their communities? Will that be a decision left to the local level?
You have a thought on that, Paul?
Yes, and I know this is something that myself and Dr. Coe and Andrew Newey spoke with legislative leaders about. As of right now, we have an executive order that basically states that in terms of local orders, the executive branch and the governor, his order supersedes them. It's important, as we've said, that this is not a virus that is in one area of the state, that we have to have uniformity in terms of our policies and understanding that for us to go from level 4 to level 1, there has to be that coordination throughout the whole state. So we're going to consistently have policies that will be uniformed throughout the state. And I'll pass it off to Indra as well.
No, I think you captured it, Paul. I think it's best that it's one policy, and then we can help the local municipalities address any issues that they have, but it's one policy for the whole state.
And in terms of outdoor bars, because I know I frequent a few of them, will they be allowed to operate, and under what social distancing guidelines? You know, stools 6 feet apart.
No bars.
No bars.
No bars.
No bars. Okay. Thank you very much.
Sorry about that, Paul, but it's just a little tougher to social distance in a bar situation. I think that's going to come along in a second stage.
Well, as long as the package and liquor stores are open, I suppose we're okay.
News 8.
For outdoor restaurants, are you considering recommending to towns and cities that they loosen their restriction on tables being so many feet from the street, so many feet? Because a lot of times those tables in the outdoor restaurants, you're banging into the person behind you. So maybe they could relax those?
I would think so. I mean, obviously, that's up to the local municipality. Indra and I have talked about this quite a bit. I've referenced before the fact that we have a lot of roads that are really not in, 50% use right now. Maybe there's some ways that we can take some of the restaurant from indoors and outdoors and give those restaurants a little more room to serve and give more social distancing. I think it'd be great for some of our towns, too.
And also understand that variances and various zoning, that's a local issue. But we can also provide the ability and the latitude for those localities to be able to make those changes very quickly as we move from a level 4 to a level 1 during this time.
And for Dr. Koh, the antibody treatment, we heard from Stanford, the CEO of Stanford Hospital, saying it was quite, I don't want to say miracle drug, but it worked very, very well. She had a lot of positive things to say about it. How are we doing on the antibody treatment?
Yes, so the antibody treatment, there have been actually small studies, relatively small studies with patients in what we called case series, right? So that's where we're giving people who are all sick with COVID, the same therapy. And this is what they've done with these, the antibody therapy, or what they also call serotherapy. The more rigorous way of doing this is actually what we call a clinical trial, or what we call a randomized controlled trial, where people are getting, the antibodies and other people aren't getting the antibodies, and they're giving it at random. Those studies haven't come out yet. And so at this point, until we have that highest level data or evidence, we really can't make an assumption about, whether this should be given to all patients with the COVID virus.
News 12, Connecticut.
Hi, Governor. I kind of want to pick up on Ken's question for a second. I know you're still looking at what legally you can do with the absentee ballots, but how do you sort of envision that playing out? Some of these groups are calling for, absentee ballots to be mailed to everyone. That there could be, just automatic ballots.
I think what we would do is mail out absentee ballot applications to everybody, or everybody within certain categories. They would be allowed to vote accordingly once they get an absentee ballot back. We would also have traditional ballot voting places around different municipalities, so those that wanted to vote that way could. That's one of the reasons we pushed everything off to August. But I really think it's important that we give some folks, especially those that are older, the flexibility that they don't have to go out to a voting place, that they can vote from home by absentee ballot.
Boceto Media.
Hi, good afternoon, everyone. Governor Lamont, since we don't have a percentage of people that is going to go back to work or be employed once the economy reopens. Is the state of Connecticut planning to establish a package of rent and mortgage relief or forgiveness to prevent homeless in Connecticut? That's my first question. And I also have a second question. Thank you.
Well, let's see where we are in a couple of months, because all of our support systems right now go more or less to June 30th. And I know we're working at making sure in terms of the homeless population, more broadly in terms of, say, the undocumented, to make sure that if they find to be test positive for COVID, we find shelter for them, not necessarily where they are right now, so they can be in a safe environment as well. You know, what happens in terms of this economy in the next 2 months or the next 6 months, I think we're all feeling our way, and the federal government will have a lot to say about that as well.
All right. And my second question, Governor, is as towns are currently talking about the fiscal year, and it's known that Connecticut was passing through a deficit before the pandemic, how is the state preparing to deal with the regular economic challenges, plus the financial struggles during the COVID-19 era? Are there any plans to partner with the federal government for financial assistance? Thank you.
No question about it. COVID-19 has decimated the budgets of 50 states. Connecticut does have some advantages. One, we had a good, strong rainy day fund. Two, manufacturing and finance and media, a lot of our core industries are going forward. But believe it, you know, you're going to find out tomorrow our sales tax, income tax went down, and a lot of our social service went up. That's one of the reasons we're now negotiating with our great congressional delegation to see what support we're going to get from Washington and how we can have our rainy day fund extend a little bit longer. Thank God it's there.
CT News Junkie.
Thanks, Max. This question, I guess, is for Dr. Koh. Testing is still hovering around 2,000 tests per day. So what level of testing is necessary to get these things done by May 20th?
Right. So that's an important criteria, and it's important for several reasons. So just to answer the question, we're really shooting by May 20th to have about 42,000 tests per week. So that's roughly about 6,000 tests per day. That's 3 times what we're doing now. You know, there's a lot of fluctuation now at this point about how many tests we're doing day to day, but it's roughly about 3 times more. And that's going to be important because we want everyone who has a COVID-like symptoms, whether they have a respiratory symptom such as a cough, or whether they have fever, or whether they have diarrhea due to this virus. You know, it may not be, the majority of people may not have COVID virus, but we want to test them to make sure that they don't have it. And that also allows us to learn whether by loosening up these restrictions and actually, but at the same time, enforcing strong social distancing, that we can actually, you know, whether we're going to have a bump or a resurgence or so forth. So that's an important thing that we're all working towards implementing very quickly in the next 3 weeks.
So if infection rates begin to increase again, what is the trigger to pull us back?
So that's where that surveillance system, we're testing people. If we see a rise there, and I think we're going to have to go through the data. And we want to catch those early signals. We don't want to wait until people die, because that's pretty much too late. So we're going to have to be really keeping an eye on those to see and understanding if they rise and why do they rise. I think that's probably the more important question, because as we're rolling out the testing, we're also rolling it out to communities that may not have had access to testing. Communities, particularly in the urban settings, you know, whether it's Bridgeport, New Haven, and Hartford, which haven't had access to that. And we will be identifying more cases as we're increasing testing. So we have to make sure that, you know, the increase in the cases that we identified is not just because we hadn't looked before and now we're finding them now, but it's actually because there's actually continued or increased transmission. So that's one of the things that, and we have a great team. We have the smartest people in Connecticut, people like Forrest Crawford, you know, from the Yale School of Public Health, Harlan Krumholtz, you know, from the Yale School of Medicine, that are really going to be drilling down and looking at those numbers every day, together with Matt Carter and his team at the Department of Public Health.
And Governor, is some of this information, I mean, even the PowerPoint presentation you just had, going to be put online anywhere or on the Advanced CT website where people can access this?
It is now. Yes.
Okay.
NBC Connecticut.
I've got two questions on two different topics. First of all, Governor, you've got people who have beat COVID and are still sitting in the hospital. One gentleman I know has been sitting in the hospital for more than a week waiting to be moved to rehab. He's being told there is no room at the only two rehab hospitals taking patients that are still COVID positive, and only one of those is actually taking patients to treat. So as you can imagine, there is already a long wait list to get into those two rehab centers. Will your recovery hospitals be able to take patients who are ready to leave the acute care hospitals but still need that higher level of care? And if not, have you thought about their care? As you can imagine, after staying in the hospital for more than a month, they're anxious to move to the next stage of recovery.
Yeah, I'm going to pass that to you, Dr. Koh, but it really surprised me. I thought the whole purpose was to get people out of the acute care and get them in the intermediate care, and we had created a strategy for that. Did you hear that question?
Yeah, I think, I think what you're alluding to is part of the solution is the COVID recovery centers that we've set up to help decompress hospitals, particularly for nursing home patients who may not be fully recovered yet, but they don't require an acute level of care at a hospital. We're now up to over nearly 500 beds that have been opened up for that purpose, of which 181 are occupied. So there is room and there's more capacity coming online to address that concern that I think you're alluding to.
This would be a patient who needs a higher level of care than a nursing home.
These COVID recovery centers are actually equipped to provide significant care to patients who need oxygen, who need other interventions, but are a step below needing to be in an acute care hospital.
So why would they have to sit in a hospital for 8 days now and keep counting? Why wouldn't they be given the option to use one of these recovery centers?
It's hard to comment on a particular case. Yeah.
But we'll be happy to follow up with you outside this press conference to talk further about an individual case.
Okay, thank you. And my second question goes to the labor.
No.
Your audio is cutting out. We'll move along next to associate.
Yes.
Now we can hear you.
Okay. So the Department of Labor started accepting applications for the self-employed, but it only launched phase one of that process, which most of the self-employed are. They were expecting that today would be able to finish their application. Now being told that won't even come until next week. Is it fair to say the DOL was their deadline today?
So Paul, I think the question involved the fact that those who are self-employed thought the checks would start coming out today. I know we've gotten the checks out for everybody else.
I think the Department of Labor, I think they've been clear that this is the day they would start accepting applications. And I know that's still disappointing. If someone's been waiting all this time, they've been unemployed since this started, it's a long time to wait. As we pointed out before, this particular benefit's brand new. All 50 states in the nation have had to stand up a brand new system to support this benefit. Connecticut's actually done an incredible job of getting it up relatively fast compared to a lot of other states. But applications are being accepted now, and then the money will be going out as soon as possible.
And it is retroactive.
I was referring to, it's a two-phase process. So phase one has already been completed. It's that second phase to finish their application that they thought they would be able to do today, that now they're being told they won't be able to finish until next week. And then after that, we'll have to wait to get paid.
We'll get back.
Yeah. Move along next to the Associated Press.
Good afternoon, everyone. I just wanted to clarify, how firm is this May 20th date? Dr. Koh had mentioned that you want to have testing ramped up to about 42,000 per week. Besides that, if that isn't online, does that mean this will not come? This won't happen? And also, you had mentioned that you wanted the 14 days of a drop in hospitalizations. Say like Eastern Connecticut, if Eastern Connecticut starts to have a surge, does that mean then that we won't have everybody start to reopen on the 20th? Just how firm is this?
I'll start with that, Sue. Right now, I look at overall hospitalization and capacity, as we said before. That's why I think it's a really important metric. So even though perhaps in New London, they've got a few more hospitalizations they had before, the rest of the state, we have good capacity, and they even have capacity in New London. So that is a metric that I think we continue to hit, although we're going to monitor it every day for the next week. If there's a surge and all of a sudden we're losing capacity, we have to take a second look at May 20th. What was the other metric you mentioned? The testing. Look, we're ramping up our testing as fast as we can. You know, Josh is every day doing everything he can, working with Jackson Labs, working with CVC, working with all of our different partners. We feel pretty confident we're going to get a lot more testing up there. The metric is not an absolute number. The metric is to make sure we have enough testing that our scientific team feels confident that we can get back to, at least selectively back to work on a safe basis.
But May 20th is not a done deal if you start to see some issues in these areas, like we don't have enough, in your mind, enough PPE. I mean, some of these descriptions are sort of vague, like it says adequate supply of PPE. So I'm assuming you're going to have some kind of metric for that, right?
If there's a resurgence in New York City, if there's a resurgence in Boston, all of a sudden we see this virus has taken on a second life, you're right, we are going to recalibrate. Right now, all indications are we can do what we said we were going to do on May 20th.
And what's the time frame between these different levels of reopening? Is that a set thing too, or is that kind of dependent upon different benchmarks being met?
So it's a minimum of 4 weeks. We will not move from one level to another any less than 4 weeks between them. But there could be 8 or 10 weeks based on what kind of health metrics and performance metrics come out. So once we open this first round of businesses, we will learn so much about how long it's going to take to open the next level.
And one last question. I was on a call today with some union members, and there was a union leader that represents grocery store workers. And the workers are concerned because they think there's going to be this pent-up demand, and a lot of people are going to be coming into the grocery stores. And they said there's already a small group of people out there that don't want to wear masks. And they were asking for something more strict to have on the books that to ensure that people do social distancing. So is that part of your plan, to have more stricter measures in place when we start to really reopen?
The reopen level 4, which is the red level we're opening now at, has very strict guidelines about wearing masks everywhere. If you leave the house, wear a mask. And so we will enforce it as part of this whole process. And I hope people follow the rules. You know, wherever I go, I'm seeing people wear masks, but I don't go everywhere, so I can understand what they're saying.
How are they going to be enforced?
Well, so we've got
I think some of it is, go ahead, Governor.
Well, I was just going to say, in terms of pent-up demand, the grocery stores have been open. So I don't quite know what that question is, but our rules are pretty strict. In these stores, you have to wear a mask. Employees have to wear a mask, and customers coming in have to wear a mask. Most of it is through self-policing right now. I think people have been pretty good, but if they haven't been pretty good, we'll find out about it and we will enforce it.
Yeah, we currently already have on the books through executive order safe store guidelines, and we're one of the very few states to actually establish that very early in the COVID process, understanding that we were going to have grocery stores as an essential element of our society during this crisis.
Thank you.
WTIC 1080 News.
Indra, do you still see these stages playing out till the end of the year?
Don't know. We have to see what happens in stage 4. We have to see what happens with the spread of the virus in the state and in our neighboring areas and the country. And after we get about 4 to 6 weeks of experience after May 20th, we can start looking to see if there's time to start talking about phase 2. This is baby steps. We have to tiptoe our way through this.
And Dr. Koh, the amount of testing that's going to happen, you said, I think 42,000 per week by sometime next month. Dr. Carter said, I believe yesterday, that a benchmark would be 50,000 per week. Is that mass testing? Because you said 2 weeks ago that mass testing would be the prerequisite for all of this.
Right. So I think to be a little bit more specific, the first priority, for testing, and the first priority for public health is to actually to test and identify all the people who are infected who have symptoms. They are the ones who are most likely to infect other people because the virus, the loads of virus they have, in their upper respiratory tracts is higher. So that's the first priority, and that's also the reason they're a priority because that's who we're going to trace their contacts and have self-isolation, not only of the people who are sick, but also their contacts. And that's kind of like the meat and potatoes of public health. We're going to, as I mentioned before, this is a highly transmissible virus. This is a virus where many people don't show any symptoms or have very few symptoms and may not know that they're sick. And that's always a difficult challenge for us. So we're going to be, the first priority is to get up to the 42,000. That's the minimum bar. We're going to be working not only to go 50,000, but higher than that, so that we can implement the kind of the mass, screening or the screening of vulnerable populations. And these are the healthcare workers, the first responders. These are people who work in nursing homes. These are the people in our densely crowded communities where the virus can spread more easily because of the high contact rate. And that's what we're shooting for. So we're not stopping just at May 20th and not stopping at that benchmark.
Hey, let me just say, I think that's the last question. Dr. Ko, Indra Nooyi, to you, to the incredible team of professionals you've put together, Dr. Ko on the scientific side, the very best and the brightest that we can do to lend scientific expertise to what we've got to do this safely. Indra putting together business leaders, large and small, and folks representing the teachers and workers, making sure what we're doing safely. Briefing of the legislative leadership on a regular basis. And the pay ain't that great, you guys. I appreciate everything you're doing. I think people of Connecticut do. And I think we have a good sense that we're going to get through this safely over the next few months, starting May 20th. Thanks, everybody.